In this video, we're going to do a deep dive comparison between Medigap policies and Medicare Advantage plans. And specifically, we're going to look at 8 different features, 8 different characteristics that are in each of these plans, and we're going to lay them side by side. Now, we've all heard the phrase, you can't have your cake and eat it too, or some say you can't eat your cake and have it too, which just simply means that in most decisions in life, there's some good, but we also have to realize there's some bad. And in each of these plans, there's some good and bad. There's some pros and cons. There's some pluses and minuses. So we're going to look at those in detail so that you'll be able to decide what is in your best interest. Now, as we look at these two systems, or really 2 ways in which we can use our Medicare benefits, we're going to look at those 8 distinct features, but there's one thing, and only one thing really, that these have in common, and that is that we have to be enrolled in Medicare A and B to be able to have a Medigap policy, also called the Medicare Supplemental Policy, or a Medicare Advantage plan. We have to be enrolled in A and B to have either one of those. Now, another thing is we can't have both of these systems. You have to use one or the other, so ultimately you're going to have to make that decision, what's best for you. But we have to be enrolled in A and B, which means what? Well, we're going to have to pay our B premium. Now, I'm shooting this video. Today is August the 30th of 2023. Right now, the Part B premium for most people is $164.90 a month. If you're on Social Security, that comes out of your Social Security check. If not, that can be billed quarterly, or they can set up some kind of electronic payment system. But the point is, we have to be enrolled in A and B. We got to pay our B premium if I'm going to have either one of those plans. Now, just keep in mind, if someone is single and their income is above $97,000 a year, their Part B premium would be more either way. If you're a married couple and your income modified adjusted gross is above $194,000 a year, then again, you would pay more than that Part B premium than $164.90. Those are called IRMAs, a whole nother topic, but I want to make sure you understand that we have to be enrolled in A and B. We got to pay our B premium. All right, so let's look at those features. First one has to do with providers, healthcare providers. And what I mean by that is this is primary care doctors, specialists, surgeons, ambulatory surgical centers, anyone that is going to be a provider. And so as we look at this, what we're talking about is who can I go to, and what are my options going to be? And so as we compare the pluses and the minuses here between these two, for sure a Medigap policy is going to be more favorable when it comes to healthcare providers than what a Medicare Advantage plan is going to be. And the reason for that is because Medicare Advantage plans have networks. They're going to be an HMO or they're going to be a PPO network. And not all doctors are going to take both of those. Some doctors take no Medicare Advantage plan. Some may take one or the other. But we're certainly going to have limited providers. Now, that doesn't mean to say there's not plenty of providers to choose from, but it's certainly not going to be the amount that would be if you have a Medigap policy. Why is that? Well, because if I have a Medigap policy, the only thing I have to do is just to make sure that my provider takes A and B. In other words, they take original Medicare. So that's all we have to find out. So any provider that takes original Medicare A and B will take your Medigap plan of choice. Whatever company you choose, whatever plan you choose, if they take original Medicare, they will take your Medigap policy. So frankly, I would say as we make the comparison, it's almost unlimited. Now, not every doctor takes Medicare, but the great majority of them do. I'd say probably 99% of them are going to. I think all hospitals certainly do. And so the point is here, that would be in the negative column because we have networks. All right. Now, the second feature that is noteworthy would be pre-authorizations. And so what a pre-authorization is, this is something that is more of an expensive type of a healthcare service needed. This would be a CAT scan or maybe an MRI. It could be a PET scan. This could be someone that needs a surgery, a hip replacement, or maybe a knee replacement, maybe cataract surgery or some other type of a surgery, either outpatient or inpatient. When someone goes to a skilled nursing facility for rehab, that's a pre-authorization. And so as we make a comparison here, the same thing is going to hold true when it comes to pluses and minuses. And you'll notice the Medigap, it's a plus side over here on the negative side. And the reason for that is because when we have a pre-authorization with Medicare Advantage plans, this side over here, about 70 to 72% of the services today are going to require a pre-authorization. And that just simply simply means that the doctor says you need an MRI, CAT scan, PET scan, you need cataract surgery, you need a knee or hip replacement, we need a skilled nursing stay. And so when the doctor orders that test or that procedure, surgery, it doesn't necessarily mean you're going to get that on the Advantage plan. Why? Because that Advantage plan has this pre-approval, this pre-authorization process. And so that proper paperwork has to be submitted by the doc's office to the insurance plan, the Medicare Advantage plan. And if they agree, then you're going to get that service. They'll approve it, they agree, they're going to pay for it. But sometimes they don't agree. They will say, no, we don't believe you need that knee replacement or hip replacement. I had one not long ago. Doc said this lady needed a full hip replacement, and the plan said, no, we think a rod only will be sufficient. Didn't get a full hip. I had one not long ago, knee replacement, and the plan just flat out said, no, we want you to go to therapy for 6 months, 9 months before we will even approve that policy, that procedure. And so the point is, you have to realize that with Advantage plans, they have the final say-so. It's not your doctor. The plan has to agree before they're going to pay for it. They may allow you to go to a skilled nursing facility, but only for a certain amount of days, typically 18 to 20 days. After that, they're going to say, no, you need to go home. And so those kinds of things are going to happen with Advantage plans. Not so with Medigap policies, because the Medigap policy has no say-so whatsoever. Okay? In other words, they can never impose a pre-authorization because they follow Medicare. So if your doctor says you need a knee or hip replacement, Medicare says they're going to cover it, end of story. It goes on the schedule, and you're going to get that service because the Medigap policy has no right whatsoever to require a pre-authorization. In fact, some of the cards med sub companies even put on there, no pre-authorizations required. All right? And so this can happen. Now, that doesn't mean to say that you're not going to get your service on the Advantage plan, but sometimes they deny it, sometimes they delay it, and you got to, if they do deny it, you may have the right to go back and appeal it. But there's more of a possibility of having interference from the insurance company where that would not happen on the Medigap policy. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, let's talk about feature number 3, and that would be permanent coverage. In other words, how long are these policies written for? Well, again, there's this distinction. When it comes to a Medigap policy, this would be the plus side. Why? Because Medigap policies are truly written for life. Once that policy has been approved and it's issued, it's your policy for the rest of your life. That insurance company can never cancel the supplemental plan unless you don't pay for it. As long as you pay for it, it's non-cancelable. It doesn't matter if you're really ill and have lots of claims. They can't cancel it for that. They can't cancel it because of your age. They can't cancel it because you live in Denver, Colorado, and you decide to move to Chattanooga, Tennessee. When you make that move, you take that policy with you because it's a portable policy, totally permanent for life as long as you pay the premium. All right, and so not so when it comes to Advantage plans. Actually, Advantage plans are only written for 1 year. Now, you may be on an Advantage plan for multiple years, but they're still only written for 1 year. It's a contract, 1 year, calendar year between Medicare, the insurance company, and you. And so that company, Advantage company, has the right to pull the plan. If it wasn't profitable for them, they can pull out of the market completely. And that's why we have this open enrollment, AEP, every year, so people can switch the plans. But it's 1 year at a time. The Advantage plan is actually tied to a service area. So if you leave that service area, if I live in Denver and I move to Chattanooga, I'm in a different service area, I'd have to get a new plan, a new set of doctors, and those kinds of things are going to happen. Why? Because that Advantage plan really is tied to that area. This supplemental plan is really tied to you. All right, and so again, that's going to be a difference. So that's why we're saying the plus and the minuses there. The fourth item I want to talk about would be switching of plans. Switching plans. Well, very similar as to the permanent coverage. The Medigap policy would certainly win here, and the reason for that is because you never have to switch it. Because again, it was a lifetime policy. Now, you can switch those. As long as your state allows you to do that. There's certain rules about that. The company, sometimes people have to go through underwriting, but you don't have to worry about switching a Medicare supplemental plan because, again, it is written for life. And the reason we're saying this is a negative on the Advantage plan is because when people enroll into an Advantage plan, if they stay on that plan for any length of time, a year, 2, 3, 4, 5 years or longer, and they decide they'd like to get off the Advantage plan and actually switch over here to a Medigap policy, in 46 of the 50 states, So that 46 would be the states that are different would be New York, Connecticut, Massachusetts, and Maine. But in the other 46 states, if you're on Advantage plan and you want to switch over to a Medigap policy, now you have to go through underwriting. You have to medically qualify to be able to get that Medigap policy. Now, when we first go on Medicare, we don't have to do that because once our B date starts, we actually have 6 months where that Medigap policy has to be issued to you. We call that guaranteed issue. You will get the policy, right? But if I start over here on the Advantage and I stay on that plan a year longer, now what happens? I'm beyond my 6 months where the company had to take me. Now, the only way they will take you is if they agree that they want to cover you. They have to go through this underwriting process, and we have to look at your medications and ask you about 30 health questions and get a statement from your doctor. So as long as that company says, yes, we think you're healthy enough or we're willing to insure you, then they'll issue the policy. But if they don't like your pre-existing conditions or they're uncomfortable with the medications that you're taking or something that's in your health history, they can absolutely say, no, we're not going to issue that policy, and then you'll have to stay on the Advantage plan. So that's why we're putting that in the negative column, because some people get on Advantage plan, they're on it 3, 4, 5 years, and then their health changed, and now they want to get off of it, and they can't medically qualify to do that, so they cannot make that switch. All right? Okay, let's talk about feature number 5, and that would be when it comes to serious illnesses. What's it going to cost us? If we had a serious illness, we had some kind of a heart issue, maybe we had to have even kind of heart surgery, or we had cancer, or we had some kind of an issue that really was quite involved, or we had to have several doctor visits, maybe several specialist visits, possibly a hospitalization or 2, maybe a surgery or so. But in other words, this is something that was very involved when it comes to healthcare services. The first thing I want to say, one of the big issues here with this serious illness would be pre-authorizations. If I had a serious illness, I would not want to have to jump through a bunch of hoops to see if I can get everything covered. That would be one thing. But also you're going to notice when it comes to the money, we would say on the Medigap, it's definitely going to cost you less than it would on the Advantage plan. And this is the reason why. Because if I have a serious illness and I have a Medigap policy, and by the way, folks, most people today have G plans or N plans, okay? So right now a G plan is about $125 a month, okay? An N plan's about $95 a month. And so that's the N and that's the G. So let's just look at the G for now. So let's say it's $125 a month. So what's $1,500 in premium for the whole year. So what did I do? I spent $1,500 in premium for my G plan. The G plan, you have a B deductible, which is this year $226. So I had $1,500 in premium. I had to meet a deductible once a year, $226. So I'm at $1,726 out of pocket. And if I have a serious illness, that's all that I would have spent out of pocket for my healthcare needs. Everything that would be inpatient, everything that would be outpatient would be covered by that $1,726. All right, now let's look at a serious illness when I'm on an Advantage plan. Well, again, multiple doctor visits, specialist visits, maybe a surgery, hospitalization or 2. Now what's going to happen, you're probably going to hit what is called your annual max out of pocket. And those range on most HMOs right now are about $3,000 to $5,000. Most PPOs are going to be about $5,000 to $7,000. All right, and if you have a serious illness, almost always people are going to max out. And so what happened? You hit that $5,000 to $7,000 range out of pocket versus over here $1,726. Now again, if someone's really healthy, they may never hit their max out of pocket. But I can assure you, you get cancer or some serious health issue, you're going to do that. So again, that's why we're saying when it comes to out-of-pocket expenses for a serious illness, the Medigap policy is going to win hands down. All right, now let's look at a couple other features here. As we talk about these plans, let's talk about monthly premiums. Monthly premiums beyond, now I'm talking about, we all know we have to pay the Medicare Part B premium, but this is beyond that. Now, as we can make the comparison plus or minus, this definitely is going to be a minus with the supplemental plans. Why? Because you're going to have to pay a monthly premium. Remember what I said? Those premiums right now in the G plans about $125 a month. N plans are going to be between $90 to $95 a month. So I have an outlay beyond just this. Now I got to pay for that. In addition to that, I have to have a drug plan. Those drug plans right now average about $25 a month for a drug plan. So again, I've got premiums. So again, that's going to be on the negative column. All right. Why positive here? Well, because most Advantage plans today are going to have a zero premium or a very low premium. I think the average right now is about maybe $30 on the high side. And so, again, very little out of pocket when it comes to premiums with Advantage plans. Well, why is that? Well, because what happens, instead of paying a premium on the Advantage plan, what I have is I have copays. I have copays and co-insurance, and so we have out-of-pocket expenses for sure, but we have no premiums. Over here, I had to pay a premium, and I didn't have any copays. If I had a G plan, I just had a B deductible. But if someone's looking at monthly premiums alone, and that's the most important thing to them, certainly then that Medicare Advantage plan would be the plus of that, because other than their B premium, not going to have to pay any premiums. They'll just simply pay as they go for whatever healthcare services that we need. And really, that's what it boils down to. When someone gets a Medigap policy, they're taking all the risk of those copays and that out-of-pocket expense and really getting rid of most of the risk other than a small deductible. Here, I don't pay a premium, but I'm assuming whatever risk for the healthcare services that I would need. Okay, but it definitely would be in the plus side there. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. Now let's talk about number 7. This would be additional perks. These were additional benefits that are not offered by original Medicare, which then are not offered by supplemental plans. So that's, again, something that we definitely see a plus side on the column for perks. Now, let me talk about these a little bit. The first perk that is in most Advantage plans is going to be a dental allowance. A dental allowance. Now, unless you're on Medicaid, that's going to be about $1,000 a year, where you can use $1,000 worth of dental services. Could be cleanings, extractions, maybe a partial little amount of money for some other kind of major service, but it's about $1,000 a year dental allowance. Also, the Advantage plans will give you a vision allowance, and what that means is they will give you a credit, maybe $200, $250 a year towards eyewear or towards contact lenses, something, again, the supplemental plan is not going to offer. And they also will cover some hearing aids. Hearing aids are going to be covered by Advantage plans. It's not all hearing aids, but they typically have some type of a reasonable copay that you would pay out of pocket to get a hearing aid. These plans also have what's called gym memberships. And so this would be a network called Renew Active or Silver Sneakers. And again, they're going to be over here on the Advantage plans. There are a couple supplemental plans that offer that, but all the Advantage plans are going to allow you to go to certain gyms, community centers, maybe the YMCA, those places, to be able to work out at no cost to you. Okay, so again, that's a perk that's offered. And then they also have a thing that's called a Flex Card. And this could be used for over-the-counter items, a variety of things. Now, these Flex Cards are really attractive for people that are on Medicaid. But typically just small allowances for people that are not on Medicaid. But again, that's just another perk. And so my point is this: Advantage plans have perks. Supplemental plans do not. There's a couple of them that will have it like a gym membership. Beyond that, you're not going to have that. In other words, these plans are following Medicare. And so if Medicare doesn't cover the dental, then the supplemental plan is not going to. So you'd have to buy your own dental plan. And a lot of people will do that as well. So Medicare covers great for vision issues, glaucoma, cataracts, all those kind of things, but Medicare doesn't pay for eyewear. And so again, you'd have to have either an insurance plan or just pay out of pocket if you're on the Medigap. So that's what we're saying. That's going to be on the negative side here. Remember what I said. You can't have your cake and eat it too. There's always going to be some good and there's going to be some bad as well. All right. So those are the features. And just one more item I want to mention. And there's many people today that are eligible for VA benefits. This is someone who served in the military. Didn't retire from the military, because when we retire from the military, we actually qualify for what's called TRICARE insurance, or TRICARE for life. A vet is just someone who served in the military, and now they're eligible to use VA facilities and sometimes civilian facilities if that's necessary. But that's very specific benefits. TRICARE is retired military. FEHB is retired civil service. This would be, people retired from the FBI or Homeland Security, the IRS or Treasury Department, different departments. They have what's called FEHB. All right, so people that are in this category, they are actually really in kind of a special situation, because what happens is the government says then these two here, they'll coordinate with Medicare A and B, or they will actually coordinate with the Advantage plan. All right, so if I'm in this category of people here, I would say the Advantage plan would be in the favorable column. And the reason for that is because I wouldn't see a need to have a Medigap policy if I was in one of these situations here. Now, there are people that choose to do that, but certainly TRICARE retired military, A and B pays first and TRICARE pays second. Or if you had an Advantage plan, what happens? The Advantage plan would pay first, and then TRICARE would pay second. So you'd still be almost zero out of pocket. FEHB the same way. And so what a lot of people do in these categories is they will do what we call an MA only plan, MA only. And that just simply means for their prescriptions, they'll get those through FEHB insurance or TRICARE insurance or through the VA. So they get their prescriptions through here, and then they get all their medical care through their Medicare Advantage plan. And what's nice about that is because when they get their meds elsewhere, then the Advantage plan will actually give you a credit and will reduce your Part B premium by sometimes $100 a month. So that makes that a very attractive deal. So my point is, if I'm in one of these three categories here, I think it's very favorable then in your situation to have the Advantage plan. All right, and so you can see there's good and there's bad, and so you have to decide what's most important for you. I would say it this way: when it comes to good and bad, a Medicare supplemental plan, I think you can tell even by looking at the chart that when it comes to coverage, ease of use, almost unlimited providers, no pre-authorizations, I think that is all the good. What's the bad of a Medicare supplemental plan? Well, the bad is you have to pay a premium for it. And so you're going to have to decide what's most important for you. Is it your coverage and the premium insurance and the use of that insurance and the ease of it? But you're going to have to spend some dollars to be able to have that. And so when it comes to a Medicare Advantage plan, what's the plus side there? Well, I don't have any premiums monthly other than Medicare. But what's the negative? Well, I'm going to have to live with pre-authorizations and networks and the fact that if my health changes, I may have to be on that plan for the rest of my life. And so you have to decide what is going to be best for your specific situation. And I'll just close with this. I want you to know that today in the market, the majority of agents, not all, but the majority of agents want to push Advantage plans. And the reason for that is because we make a substantially higher commission. They truly do pay us more on Advantage plans, and that's why a lot of agents don't even want to talk about Medigap policies. What do they want to talk about? They want to talk about all the perks and the zero premium, right? But that's not fair to you. You also need to know how your insurance is going to work. And again, as a company, we will write Advantage plans when it's in someone's best interest to do so. But you have to decide, how do you want your insurance to work? And again, agents push Advantage plans because the commissions, they're higher, and they're also lifelong commissions. Medigap policies, of course, pay us a commission, not near the amount as a Medicare Advantage, and certainly not a lifetime commission. But again, any agent that really cares about you and cares about the fact you're making a decision about coverage, not about their commission, but about coverage, will show you both of those so that you can decide what's going to be best for you. Can't have your cake and eat it too. You have to decide the good and the bad that you're willing to accept.